Let's talk to someone who's been very critical of government policy so far on containing the virus. Rory Stewart, he's former International Development Secretary for the Conservatives, obviously stood, of course, as a Conservative leadership candidate and is now independent candidate for Mayor of London. Good morning to you, Rory.
Good morning to you.
You've been critical as somebody who's critical of the idea that we're not actually following the science and not following best practice and not learning from what has happened in other countries who have suffered major outbreaks. Obviously, of course, starting with China, but South Korea, Japan, and also more closer to home, Italy. What do you think the government isn't doing that it should be doing?
Well, we're being far too slow. In an epidemic like this, you should be moving immediately with no regrets. The earlier you shut schools, the earlier you stop gatherings, the better. Because, as of course is common sense, the more people meet with each other, the more likely they are to pass on the disease. And somebody who is working from home or is self-isolating is not going to be coming into contact in the same way with people who have the disease. And actually, countries that have done this really quickly have achieved very remarkable things. South Korea has actually very dramatically brought down the number of new cases in about 10 days by doing this. But if you start too late, it's out of control. It spreads like wildfire, and it then becomes almost impossible to contain.
We know, obviously, Italy tried to bring in some measures earlier on, for instance, banning flights from China and the like, and it would appear the biggest issue that's happened in Italy is that they actually had the virus for some 2 or 3 weeks before they realised it, and it was basically infecting everyone across the northern region of the country. The Southeast Asian countries that have acted really quickly, they did act very quickly, but again, they were able to act during the containment phase. Were there not a few weeks lost where actually, if we hadn't just isolated the country almost immediately, closed down the airports early in January, that actually once that point is passed, then you're past containment, in which case you can't just sort of isolate everybody when there's only sort of 2 people who've died of a disease.
Well, there is a lot of academic disagreement about this, but the World Health Organization argues, and I absolutely agree with them, that you act as fast and as hard as you can. You never are quite going to know whether you're going to be able to do it, but you throw the kitchen sink at it. You try as hard as you can. Because many people felt that China, it was already too late. They had got up to nearly 80,000 cases. But by taking very radical action, they were able to reduce it when all the academics thought they couldn't do it. In Britain at the moment, we believe we're still at a few hundred cases. So if China managed to start bringing the absolute numbers down when they were moving up towards 80,000, we can do it in Britain. It's just a question of willpower.
What about those who say, look, the government is following the scientific advice? And Boris Johnson said yesterday that, there are lots of things you can do which are sort of look big ticket items. You know, what Donald Trump has announced overnight, limiting those flights in from those 26 Schengen area European states. What Italy's done, in terms of cancelling football matches. And like, you can do things that look very big, but actually, as we've heard from the chief scientific officer and the chief medical officer in the last week, don't actually have any real bearing on the number of cases you end up getting.
That is true for some things, but we are being much too academic about this. There is a huge disagreement, which we're not being honest about. We're pretending that all the scientists agree. What's actually happening is the British government is following a very particular, narrow academic model, and other countries are taking a completely different approach. Denmark, for example, has closed its schools. I don't think that's because Danish scientists are somehow less qualified than British scientists. It's because all the evidence from previous epidemics elsewhere in the world are the earlier that you move, the more likely you are to be able to get a grip on this disease. Okay. And I'm worried that the approach that we're taking is actually slightly more worrying than that. It feels as though the government is saying that they don't believe it's actually even possible to reduce the number of cases. They're beginning to talk about delay in terms of simply slowing the increase. And that is an extraordinary thing to do when countries like China, South Korea, Taiwan are showing that it is actually possible to reduce the number of daily deaths.
But isn't that because they were able to act when it was clear that it was going to be going to those countries, so especially they're so close to China, that they were able to contain? And again, the quarantining of Wuhan and in the whole Hubei province and those cities are partly able to take place because of it's a totalitarian police state state, much easier to do it there than, say, in Italy, but also because it was contained geographically. But it isn't contained geographically in this country. Once we've had that spread, we've had spread within the country. It's not just come from overseas, people who just come back in from Wuhan or from Italian skiing holidays. Once it's not contained geographically, then the quarantining is only capable, surely, of delaying rather than preventing.
We are actually at the moment at exactly the same point that China was when it introduced the radical measures in terms of case numbers. By the time China introduced its measures, 5 million people had already left Wuhan. So these academic experts that are driving it in Britain said that it was too late in China to act, and the Chinese proved them wrong. It isn't too late yet. And we should have acted 2 weeks ago, we should have acted a week ago, but if we act today, we can still get on top of this.
In terms of the closing the schools, though, we need key workers to be at work. We already know that in many of the countries that have been hard affected, it's actually something like 15% of those affected are actually key workers in the health service. We need key workers in the health service and police to be able to go to work. How are they going to do that if their kids are off school?
Right. If we allow this to get out of control, the number of cases can double every 3 to 6 days. And because of the mathematics of that means that you can get from the current number of cases that we know about at the moment to about 128,000 cases within a month. That means that all the benefits that you might get from having more nurses around are completely overwhelmed by the number of cases that begin hitting your system. So every country has the same balance, but most other countries have decided that the correct way to do it is to close the schools, except that means that, very sadly, it imposes pressures on families and, of course, pressures on the health system. But the benefits you get out of that is that you have a chance of reducing the number of daily cases. Okay. But we're going to have to do that now. If we don't do it now, and this is one of the things, Julia, I think, which is a cultural problem in Britain, is that we're very, very proud of our keep calm and carry on and don't panic. That's fine, but as somebody who, I was the minister who was involved in leading the UK part of the Ebola response. So I was in Eastern Congo with people with Ebola. I've worked in Iraq and in Afghanistan, and in emergency situations, it's true actually in flooding responses too, that the answer isn't to get into a conversation about whether or not to panic. The answer is to get on and do things and communicate effectively.
Okay.
And sometimes saying don't panic actually simply means that you're denying the truth. You're hoping that everything's going to be all right.
Just one final question.
It's not going to be all right unless we do stuff now.
Just one final question. There are those who say, look, why are we making such a big deal of this? Yes, it's more dangerous than flu. It's more contagious than flu. But we are still talking about 1 or 2% death rates in Western countries. It's the elderly, it's vulnerable people who, and again, I'm not saying this, but some people I've seen are saying this, it's elderly people, underlying health conditions. They were going to die in a couple of years anyway. Why are we shutting down our entire economy, shutting down our entire lives for what is a bad flu outbreak? Some people are saying. What would you say to those people?
So that's a very good challenge, Julia, and that's basically what some academic scientists and modelers are saying. But what they're forgetting, of course, is a couple of things. One is that those people are my mother, who's 83, and many, many other people's mothers.
Yeah.
But secondly, that 1 or 2%, if this gets into your whole population, is an unbelievably large number of people. And that's 1 or 2% who might be dying. Even if it was 0.5% of people who are dying, those people are dying. And probably 10 times the number are going to have to go into hospital with very, very serious illnesses. And by doing so, they will be displacing many other patients that need to be in the hospital system. So the numbers that you're talking about, let's say it got into most of the British population. Let's say 50 million people got it. Let's say only, in inverted commas, 10% needed to go to hospital. That's 5 million people. Imagine it was only 1% who died. You're talking about 500,000 people dying, 5 million people going into hospital. This is something on a scale so far beyond any type of flu that saying this is like a flu is giving people a very strange impression of things.